Okay, let's begin. Good morning, everybody. Thank you for joining us today once again. Just a quick housekeeping announcement before we begin. Our speakers will be taking questions via the Q&A button. So if you have questions, do submit them. The Q&A button is at the bottom of your screen. And the session is being recorded, and we'll have this placed for on-demand viewing on our online digital edition starting from 1st of August as well. So with that, I shall hand over to our first speaker for today, Mr. Mark Tim. Mark, over to you.
Thank you very much. I'm so glad to be here and excited to share with you everything that I can about IntegriMedical and about some of the new innovations in the medical device space that have really been brought to the forefront due to some of the global events that have been happening over the last couple of years. And so with that being said, I am going to share my screen and I'm going to go to a presentation that we have shared. This is IntegriMedical. We are advancing the innovative drug delivery systems in the space of biologics. IntegriMedical is all about being a market leader. We are all about research and development. We're a leader in providing innovative solutions for the global needle-free injection system market. We are patient-focused. We facilitate effective workflow so healthcare providers can focus on what fundamentally matters to the patients. We are all about compliance. We're a compliance innovator. We're a leader in CME compliance, training with the needle safety, OSHA compliance training, and CME class in the marketplace and approved for 125 AMA PRA Category 1 credits. We are effective and trusted, approved for use in multiple markets and categories, including animal health. And our headquarters is globally based in Phoenix, Arizona, and we are also based in Pune, India. And so those are our two global headquarters. We are definitely a global business, and we are focused on solving this solution of biologics delivery globally. And we are driving alternative delivery and demand. The demand for the injectable needle-free market in vaccinations, pain management, the demand has never been higher. I have to tell you, there are ups and downs due to COVID, but the ups are for us have to do with, obviously, nobody has to understand the need for injectables. You don't have to talk about needles to know that this is a global issue. And supply chain interruptions is huge. There's a high possibility, and we're already seeing it globally, of a needle shortage due to just the COVID-19 vaccinations alone. Sharps shortage and disposal. With 16 billion injections worldwide, environmentally friendly disposal of sharps is a real challenge. Getting rid of those needles is a real challenge. And so we believe there's an alternative to that in the needle-free delivery system. Needle stick injuries are real. There are so many different needle stick injuries, from nurses to doctors. All of the client care that takes place in delivery of biologics impacts the safety and efficacy around biologic deliveries with needles. And what we've seen is just an increasing amount of the needle stick injuries and the impact that it has on hospitals and supply chain. And then you have, of course, needle phobia. And we like to say that a third of the world is needle phobic. And that's 1/3 of the world. That's not a United States issue. That's not an Asia issue. That's not a South American issue. That's a global issue. 1/3 of the world is needle phobic. 2/3 of the world doesn't necessarily like needles. So we definitely have the attention of the world when we talk about an alternative delivery to needles. Lessons learned from a global pandemic. Over 1 billion needles required during this pandemic. 16, just in the United States, by the way, 16 billion disposable needles and syringes globally, worldwide, 850 million needles and syringes just in the United States. And there is such a need for an eco-friendly solution. The sharps and medical waste generated from a rise in needle demand calls for a much more environmentally friendly solution to injectable delivery. And then, of course, there's the medical staff shortages. And so alternative delivery, alternative ways of delivering biologics has never been more of an issue. So therefore, this paves the way for a needle-free solution. The number one thing that we're looking at increases comfort. Needle-free increases comfort. The patient and providers have reported less swelling using our system. Improves safety. Protects the patient and the provider from needle stick injuries. You're not going to get a needle stick injury from a no needle solution, and it reduces the exposure to blood-borne pathogens. It's efficient and it's convenient. Its pre-filled options offer easy deployment and consistency, and the delegation of injection administration allows higher skilled staff members to complete more complex tasks while empowering less skilled staff to administer needle-free solutions. So let me go here, and I'm going to actually shift off the presentation, and I'm just going to go live, and I'm going to share with you the needle-free solution that IntegriMedical has developed. And so I have that in front of me, and I'm going to show that to you. And it evolves from a injector. So here is the entire system, looks like this. And I will show this to you right now. This is our entire system. So it's very tidy, it's very convenient, it's very safe and efficient. And so when you open this up, you end up with a injector, and this is the injection device, and this is the loading device. And I just want to demonstrate for you how this device works, because I could go through our entire presentation here. In fact, I'm going to go ahead and I'm going to share screen again, and I'm going to go to here, and I'm going to go one screen down to right there. So that's really where I'm at right here. So I'm showing you our system, and I'm showing you the cartridges, I'm showing you the loader, I'm showing you the injector, and I'm going to go one step further. I want you to see and experience this. I feel like in the short time that we have together, why not show you how this whole process works? So here's the injector, here's the loader. You can see how easily that fit into the loader. And I simply close the loader, and now the device is ready to go. And I simply reach into the kit right here, and I'm going to pull out a cartridge. This is a cartridge right here. I'm going to open that cartridge. And this right here is the cartridge that will carry the biologic. I happen to have a B12, which is a very simple biologic that is excellent for our technology here. And I'm going to insert the cartridge. I'm going to raise up the cartridge. I'm going to actually extract the biologic. I chose B12 so you could see the biologic coming out of the vial right here. And I'm using our vial adapter, which allows for easy extraction from a vial into our cartridge. And so then I'm going to open up, and I'm going to extract the injector, and I'm going to insert the cartridge into the injection device. I now have a fully loaded cartridge inside of an injector right here. And just for the purpose of this demonstration, I'm going to use this foam device right here. This is going to simulate the human body. This is going to simulate the whole process that we use for a needle-free injection. So imagine this is the human body. This is the injector. This is a needle-free cartridge. I'm simply going to press into the human body the same way that you would press on anything. And right here, you see the B12, and I'm going to show you. I'm going to go 3, 2, 1. I'm going to press the cartridge. And I just injected the B12 into the foam, which demonstrated the human body. And you'll see that in the foam, there's absolutely nothing left over. We just injected 0.5 milliliters of B12 into this foam. You don't see anything left over, in the same way that you wouldn't see anything left over in the human body. Now you're left with a cartridge that, by the way, has no needle. Okay, so you don't have the same disposal issues that you do with the sharps. This can simply be disposed properly, and you have no issues whatsoever. And I will share with you again, this is what the entire kit looks like, just like the screen shot that you have right there. It's very, very functional with regards to how it operates. This is our IFU, and then you're looking at the entire kit right in front of you with the cartridges, with the vial adapters, with the injector loader, and then the testing foam right there. So I just wanted to spend my time with you showing you how simple it is to be able to deliver a needle-free injection. The needle was developed 150 years ago. 150 years ago, the needle was developed. And so we're talking about a technology that is 150 years old, and it is way past time for a disruption and an innovation in this technology. IntegriMedical has that disruption, has that innovation, and you are going to start to see needle-free injections in your lifetime. In fact, I predict in the next few years that if this is the first time that you've heard about needle-free injections, you will remember this day, because it will not be the last time that you hear about needle-free injections. I believe that needle-free injections will be commonplace, and I believe that IntegriMedical is at the forefront of that technology. And we've gone a step further. Not only do we have a solution for biologics delivery, but a lot of vaccines are delivered right now in the form of a pre-filled syringe. And so what we've developed is a pre-filled cartridge. And so what that allows us to do is to take an adapter and attach it to a pre-filled syringe, extract the biologic from there into our cartridge, the same cartridge that I demonstrated the B12 on. We can extract that from a pre-filled syringe into our cartridge, and then we can deliver it into the human body through a needle-free solution. So IntegriMedical is thinking forward with regards to vaccination delivery, with regards to biologics delivery. And we just simply are in position at the time and place where this is a global concern, and we want to be the solution to that global concern. The pre-filled functionality increases sterility. It is a growing demand for biologics. The self-injection safety, the cost-effective, and it's very accurate. You have so many people that are delivering an insulin injection, and they're developing scar tissue. And when you develop a needle-free solution, you don't have the same scar tissue that you have whenever you are experiencing a needle. So the point is that we want everyone in the world to be able to offer a needle-free solution to their patients, to their clients, and we have that technology, and we believe that this is the forefront of what you're going to see. And we want all of you to experience this. We want you to see it with your own eyes. We want you to experience it with your own hands. And we are excited to be at the Medical Fair Asia Singapore, August 31st through September 2nd. We are in booth 2P20. And if my team is listening, if you could please put that in the chat. We're in booth 2P20. So 2P20 is where you can meet our team from IntegriMedical. You can see this with your own eyes. You can experience it. In fact, I can tell you right now that if you will show up to our booth, you will have the opportunity to literally do your own needle-free injection so that you can experience this innovative technology for yourself with your own eyes. And that's really what we want you to be able to do at IntegriMedical, is to experience that, to see that, and to appreciate the shift and the pivot that's happening worldwide. There's no reason for a third of the world not to receive the vaccination they need, the biologics they need, because they're needle phobic. And there's no reason for someone that just simply doesn't like needles not to get the delivery that they need when the needle-free technology is available. And we plan to make it readily available worldwide. So we're excited to have you join the needle-free revolution. We're excited for you to meet our team and to experience this technology for yourself. So thank you very much for your time. If you've got any questions, please let me know. We have patented technology. We have clinical evaluations. If you'd like to reach out to our team, let me go right to that slide. Right here is the slide. If you want to reach out to customer service at IntegriMedical.com. If you want to learn more about IntegriMedical, go to IntegriMedical.com. If you're interested or you have know somebody that's interested in distributing this kind of technology worldwide, please go to customer service at IntegriMedical.com. Thank you very much for your time, your attention, and for inviting IntegriMedical to be part of this worthwhile summit.
Thank you so much, Mark. It's very exciting indeed. So let's see, I think it will take some time for the questions to come in. So maybe in the meantime, we will hand over to Christian to bring us through his presentation, and we can address all the questions at the end of the entire session. So Christian, thank you, Mark. Christian, over to you, please. And
all right, so it helps to have comms. Can I get an indication that you have a visual?
yes, it's all clear.
Okay, wonderful. Thank you. So thank you for having me. I'm going to talk to you today about Seal Shield. Interesting enough, in this day and time in the pandemic, it's noteworthy. Seal Shield, we actually started in 2007. So we've been fighting the infection control battle for many, many years already. We are a global company. We're headquartered here in the US with operations in Germany and Canada, the United States, and in Hong Kong. Our focus specifically is around infection control technology in healthcare. And I'm going to walk you through a couple of key products that we have developed over the last decade and a half, and what we bring to the marketplace in our primary markets today, which are the US, Europe, Australia, New Zealand. And we are anxiously looking to expand into Asia as I speak. So without further ado, I'll go ahead and get into a little bit more of the company, then we'll get into some products and some research. So as I mentioned, we're an infection control technology company. Really, at our core mission, we're here to prevent infections and save lives via technology and data management. We do this through all of our innovative infection control solutions with a focus at improving healthcare outcomes, reducing the cost associated with hospital-acquired infections. And we do this through really focusing on devices that minimize cross-contamination at an environmental level. So when we first began the company, we began with the world's first ever, in 2007, waterproof and dishwasher and antimicrobial keyboard and mouse. And that's what we became known for globally. Now, several million units later, you can find our keyboards and mice, the first products we brought to market, all throughout the healthcare system. So we provide an avenue and a capability for hospitals to disinfect devices that are commonly touched and shared amongst many staff, as well as visitors and sometimes even patients. We're going to focus a little bit more so on our medical device, the electroclave, that's pictured here in the center, and talk about what we're doing with the electroclave and how it came into the fold over the last few years, since about 2015. So in the US, over the course of 2020, all of the hospital-acquired infection data that's reported up to our CDC really was put on pause. And I say that because it's very important. So we stopped reporting on hospital-acquired infections in 2020 for the first almost 4 months, so the first quarter of the year, due to the simple fact that our hospital systems were overloaded and taxed with trying to deal with the pandemic. So even though we didn't report our hospital-acquired infections over 2020, we saw something that we've seen happen year over year globally. And that is that hospital-acquired infections are on the rise. In the US specifically, there was a 24% increase in CLABSIs in 2020, a 35% in VRE, and 15% in MRSA. Now that is, again, all said with the lack of 1 quarter worth of reporting on data. So we know that hospital-acquired infections are still on the rise. We were focused on the pandemic as we should have been, like most every other person in the world was, but there are larger issues at hand. So let's get into specifically one of those. So in the US, this study was aimed at really looking at the phones. Everyone in today's healthcare system and time carries a PDA or a smartphone, whether it is issued from the hospital, it's a corporate owned device, or it's a personal device. And in the study, what we found is that 53 out of 104 phones from physicians yielded at least one pathogen, a pathogen that would have led to a potential infection with a patient and or a staff member. And so then when speaking with those physicians, you find out that 46% of them clean their phones only once a year. Then you drill down a little bit further, 34.8% cleaned weekly to sometimes daily, and then 17.4% never cleaned them ever at all. So you have a device that's carried on person with the nurses, with the doctors, with all the staff, again, personal and or corporate. 53 out of 104 of those are carrying a pathogen. We're not cleaning them well, and they're coming in close proximity. They're coming to the bedside with patients, right? Mobile devices have become a thing of our daily habit, and that habit doesn't really change when we show up to work, specifically at hospitals. So the electroclave that I'm going to discuss with you was a product that we developed back in 2015. The electroclave is, in the name, as you could expect, it is an autoclave for electronics. And we really aim at specifically small portable handheld electronics. That's our focus with this first device and its first generation. Going back to 2015 when we launched in the US, we launched in 2017 in New Zealand, and then in 2018 in Australia. And this device carries patents both in Europe as well as New Zealand, Australia, and the US. So what it does is it utilizes a UVC LED functionality to be able to disinfect portable electronics without causing material degradation through the use of our patented UVC LEDs. That's very different than all the other UVC devices on the marketplace that use mercury-based lamps. We really strayed away from mercury-based lamps in the very beginning because of all the material degradation that the lamps actually cause. So we're going to get into a little bit later in the presentation. So I'll keep moving forward here. Today in the US, the electroclave has been tested and data was submitted to the EPA. And through the EPA's review, they confirmed that the electroclave is 99.9% effective against the following bacteria. And there are many more bacteria. We urge you to visit the booth and speak to one of our colleagues, and they'll talk to you about all the additional organisms that we've tested as of to date. So 360-degree disinfection is really important when you talk about UV. A lot of people have developed UV devices. When we did this in 2015, again, way ahead of the curve, we really knew that in order to use light radiation, that you had to saturate the device that you were disinfecting 360 degrees around. This falls into all of our patents. So in this simulation here, we'll give you a close-up view inside of the actual disinfection chamber and show you with the lighting pattern how a phone in our disinfection chamber is saturated with UVC light from 360 degrees. If you do not saturate the device from 360 degrees, these devices are quite frankly really ineffective in solving the problem, specifically as it relates to disinfection. The cabinet, also a feature that is part of our patents and very specific. to UVC light disinfection, you really have to have a dust and particulate-free chamber. Dust and particulates actually create shadows for the UVC light to actually be effective and to actually deliver the 360 degrees. So our cabinet is actually positive pressure and HEPA filtered. So all of the air that's coming into the cabinet, which I'll show you in this simulation, is first brought through a HEPA filter. We create positive pressure in the cabinet by stripping all the dust and the particulates out during the intake. And then all that air is actually pulled in through the cabinet across the devices that are being disinfected and then exited on one side of the cabinet. This allows the pressure inside the cabinet to remain positive so that even with the door open, that we do not ingest dust and particulates into the disinfection chambers, which would then yield not such a great efficacy because of the dust and particulates blocking the light radiation. From an enterprise standpoint, when we developed the electroclave, we developed this on the back of some very large health systems that have standardized on the electroclave here in the US. And one of their big wants in the design was really enterprise scalability. So most of our hospital systems have thousands upon thousands of mobile devices and handheld electronics deployed throughout their healthcare system. And so they really can't have a one-off device that doesn't have multiple disinfection chambers and that cannot be daisy chained to create an environment to where they can easily increase their capacity by 2 to 4x simply by integrating our cabinets into a tower. So enterprise scalability was very much on the forefront of our design. And then truly providing a healthcare solution that can grow with the facility. Again, as they go from, in 2015, we remember health systems having upwards of 300 to 400 devices deployed. Today, those numbers are in the thousands. So we're going to talk a little bit about simple user interfaces. So a lot of studies were done and pilots were conducted at multiple healthcare systems here in the US to determine really how does the individual need to interact from a user experience with the cabinet, right? It's a very complex procedure on the inside, but you need it to be very simple for the end user so that your adoption is high. And if your adoption is high, then you're going to get the utilization and you're going to be able to get the effects that you would expect by disinfecting these mobile devices. So from a simple user interface, up on the left side of the cabinet here, we're going to rotate the cabinet and show you that in real time, the cabinet lets the individual know that the device is ready. It lets them know when the device is cleaning. It lets them know when it's clean. And if they were to interrupt a cycle, it lets them know that it's dirty. So really simple text that can be translated in various regions to give an end user a state of what's going on in the cabinet right now when I walk up to it. A little bit of a delay here, I'm sorry. All right, so another advantage of the electroclave from an end user standpoint is that we have actually enabled a badge reader into the cabinet. This allows our end users to access the cabinet with either a generic badge and or unique badges. So one of the key things that I haven't touched on quite yet with the electroclave is everything that we disinfect, we actually track. So we know every phone that's been disinfected and we know who took that phone and we know who put that phone back into the cabinet. So we track all of our devices, not only with end user access, whether it is the badge reader or the keypad at the top, but all the devices that go into the electroclave are also RFID tagged. So this way we can start to paint a picture for the healthcare system to let them know what's being done. And when things are not getting done, gives them the data so that they can take action to ensure that we don't have dirty devices going into critical areas of the hospital that could then lead to further contamination or infections. So I talked a little earlier about material degradation, and I wanted to bring this slide up because this is very important for you to understand. UVC devices that leverage mercury-based bulbs as the generator. These devices, you've seen them, they're a dime a dozen since the pandemic. They really are not a long-term solution for healthcare. This is due to material degradation. So a study that we've run here shows an actual ABS plaque here on the left before disinfection. And then after just 72 hours of exposure to disinfection, what you can find is that the mercury-based lamps have degraded the materials. They have not only discolored that ABS plaque, but we took SEM images of that particular plaque. And what we found is that a phenomenon with polymers occurred, which we call crazing. And to sum it up in a more simple term, this means that it has now created a plastic that is unsuitable to disinfect with UVC. So a mercury-based UVC system turns plastics into a surface that can no longer, after 72 hours, continue to be disinfected with UVC. Why? All the pathogens and microorganisms fall into all of these cracks that you see in the SEM image. This is same magnification before and after exposure. And once the organisms are in these crevices, they can no longer be disinfected. The electroclave is unique in that it uses a UVC LED system. It does not use a mercury-based system, so therefore we have zero material degradation in our cabinet. We have proved through lengthy studies that we do not have any material degradation in the electroclave. And we've done that through studies to include TGA analysis, to where we've inspected polymers through the TGA process to ensure that there has been no molecular change to that polymer over, again, that same 72 hours of disinfection. So the electroclave has multiple configurations beyond being scalable from an enterprise standpoint. It comes in a 2-bay, so 2 disinfection bays, 3 disinfection bays, or 4 disinfection bays. These are all configurable because hospital systems have different mobile devices or handheld electronics that they need to disinfect. And sometimes they need 2 large bays and a 2-bay, or in other cases, they need 1 large bay and 2 small bays for mobility. Or it's strictly they're trying to disinfect mobility, so then they want 4 bays in their electroclave. So multiple configurations to help the customer really tailor the solution to get after disinfecting the electronics that are of concern to them.
Christian, sorry to interrupt. Just wanted to check in if you will be ending soon, as we're running a bit tight on time.
Yes, just a couple more minutes. Thank you.
Okay, great.
So another thing that is very important about the electroclave is that it has an intelligent maintenance package. So when you start rolling out solutions like the electroclave, you have to be able to monitor these solutions and ensure that they're being kept up with. They do have consumables, the disinfection modules, and the HEPA filter has to be changed. And so the electroclave, with its intelligent maintenance, it's monitored by our portal on the back end. So all of these devices are IoT. We monitor them and ensure that they are running, they're operationally sound, and we can alert you ahead of time when consumables are needed to be replaced. So that's our predictive maintenance model with our real-time monitoring. And that's about it. So I will now turn it back over to you. Thank you for having me. Appreciate it.
Thank you so much, Christian. So please have your questions coming in. If you have any, submit them through the Q&A button, and we'll address them at the end of the session. So now let us hand over to Carl, who will bring us through his presentation. Carl, please.
Thank you. Maybe I can get this to work.
Yes, it's perfect.
All right, sounds good. Thank you for inviting me. I'm going to spend a little more time doing some teaching, actually, rather than selling. I wanted to explain really the basis of using air ionization to help medical manufacturers increase their reliability, safety, and yield. So I have a lot of background in the industry. I've been around for 35, 40 years doing ESD control or static control, I guess would be a better term, and contamination control. A few years ago, a couple of coworkers and I at IBM, excuse me, I'm getting over COVID right now, so still coughing things up. A couple of colleagues of mine from IBM and I wrote a book. It's over here on the left. You can get it at Amazon. If you have an insomnia problem, it'll help cure your insomnia. But it is a textbook level type thing, graduate level text. It's several years old and has some applicability to medical device manufacturing, but it's more aimed at the electronics and disk drive manufacturing. But as a result of that, I've been involved, in addition to that, I've been involved with the ESD Association for years, doing training, teaching, writing standards. I ran the standards organization. I was on the board of directors. So I've been around a while, and I've been branching into the medical world in the last, say, 5 years or so. It's been enlightening, and got some exciting things to show. So the first question, I guess, was, would you, as a medical manufacturer, like to eliminate all or most of your foreign material losses? We have a method that can do that. And I'll talk more about why that works from a physics standpoint through this presentation. This is a graph of a customer we helped who was running about a 15% scrap level historically. We installed ionization in their gowning room and their manufacturing line. And over a period of about 3 or 4 months, brought their yield loss due to FM down to less than 1%. And that has held, as far as I've heard from them historically. We're going to talk more about why this works and how it works. So this is a picture of their product. It's a catheter. Instead of on a 3x5 picture, it was 100x. It's bigger than that on the expanded on your screen, but you can see it's a nice clean catheter right out of the package. Unfortunately, through the handling of that catheter in the process, this is what it looked like a few minutes later. This is the foreign material that collected on that catheter because it had been charged due to handling, and that charged material became a magnet for all the contamination that was in the process and near it. How does this happen? Triboelectric charging is the kind of the bane. It's a continual thing that occurs in every process. And the best example of it, of course, is a piece of Scotch tape, where you have a piece of tape peeling off of a reel. One surface becomes charged negatively and the other surface becomes charged positively. This charging occurs whenever two materials make contact and separate. There's no way to avoid it. It happens in almost every case. This also happens with airborne particles that are floating around in the air. So every clean room, even though we try to clean them up, there are significant quantities of particle floating around in the environment. And of course, as they run around and run into each other, they join, make contact and separate and charge. Then they're looking for an item of opposite polarity, like maybe your catheter or your medical device, and they're going to attract particles from as far away as a meter that are of the opposite charge. This is what's called electrostatic attraction. Electrostatic attraction is probably, we estimate, causes about 95% of the foreign material loss in the industry. In other words, if you can resolve your static issue, you will resolve 95% of your foreign material scrap issues and rework issues. There's other things that the static electricity causes, products sticking in misalignment during tool process handling, like small parts that are being charged in vibratory poles and feeders. We try to get them to orient a certain way and they don't, they stick together and they don't feed properly. Personnel shock is another main big effect of this. It's not something that hurts people physically, although their reaction to the shock sometimes does. And then also ESD damage of electronics. The ESD Association has been involved in this for 40 years, trying to control ESD damage for electronic materials. Of course, this is starting to rear its ugly head in medical devices as well, because many of our electronic pacemakers, defibrillators, neuromodulation devices and things like that have electronics that are becoming more and more sensitive to ESD damage. So this is becoming a more critical problem as well. The advantage of this is if we can control the static electricity, we can control all of these things. So how does air ionization play a factor in this? What we do is, if you have your insulated material here on the bottom, it's got positive and negative areas of charge on them. We're going to fill the environment around it with positive and negative air ions. When we do that, opposites attract and we neutralize the charge on that insulated material. This also occurs with the particulate that are floating around in the air as well. As those particles that are charged hit an air ion of opposite polarity, they become neutralized. Now they're not looking for a surface to be attracted to. Products that are involved that we have available are many types. There are overhead blowers, and there's also what we have called room systems. This picture on the right-hand side is of a room system where you can see the ionizers are hanging on the ceiling. They're fed with low voltage cable from a controller that's placed over on the wall somewhere near an outlet. And we fill the room, the clean room, with air ions at that point. The localized blower, or what we call point of use blowers, or this is a 3-fan unit. We sell 2, 3, and 4-fan units. We also have single fan benchtop, and I'll show that in a minute. But this is a classic example of covering a workbench. There are pros and cons to all of these systems. The disadvantage of the point of use system is that if you have your product underneath this airstream, it's being ionized very effectively, and the particles in the air around it are also being ionized. The problem is if you move that out of that airstream, immediately when the materials make contact and separate, you get charging, and it is no longer effective. So that's the advantage of the room system. So some more graphics here. The overhead blower, you can see the air blowing down. Benchtop blower on the right blows across the bench onto a microscope or another operation where people are handling them. Again, there's many different types and configurations of air ionization systems. The other factor that we have found that works really well is tied to this issue of airborne particulate being discharged. One of the 2 different sources of information. The one on the left, the IEST, or these are the folks that writes the clean room standards. They own the ISO specifications for clean room technology. And they did a paper a while back where they published that about 35% of the contamination in a clean room was tied to what they call people type particles, skin flakes, hair, clothing fibers, things like that. This guy over here, Clark, back in 2016, wrote a paper that found about 65% of the contamination in the study that he did. So whether you believe one or the other, it's fair to say that 30 to 65% of the contamination in a clean room is from people. And if we can reduce that in some way, that's going to make everything better. What we found is that if we are careful and we ionize the change room and the garmenting process, and don't ignore the people as they're coming into the clean room, don't ignore the airlocks where product is being brought in, and you actually ionize those environments, we can reduce the amount of contamination that's brought into the clean room to those very dirty locations. So this is a picture of a typical gowning room where we've deployed air ionization in the ceiling. And we also place overhead blowers over the doors, both coming into and going out of the garment change area. This graphic shows kind of an idea of how it works. Particles are being brought in by people, of course. They hit the air shower, which we're calling an air shower. To blow a 4-fan blower that blows ionized air down over them. They go through the garmenting process. Then they are hit again with more air ions as they leave with some air velocity. And then when they go out on the process, they're not taking all this contamination from here and dumping it onto product, because we placed air ionization out in the process. So we can eliminate, it's estimated between about 1 million particles from a garmented person that would normally be drug into a process per person. So 1 million particles per person per day. Some case studies where we've implemented this. The one on the left is one I showed earlier. This one on the right is another manufacturer, another catheter manufacturer. And as we deployed air ionization in their process, we actually made their problem worse. And this is where we learned we really got to do the garmenting change room as well. So we've made it a little worse, but then we added ionization in the gowning room, came down. They had a fairly long pathway to walk from the garmenting process to their process area where they were being, handling product. And so we ionized that as well. Manufacturing or the management didn't really believe that ionization was their solution, so they had them turn it off, and the problem came right back. So we're pretty comfortable that air ionization made a really big difference and it works well. So we're estimating we put about 100 or more of these systems into various medical manufacturing facilities, and in almost every case, we've been able to help them reduce their yield loss due to foreign material, basically eliminate it, or to be down to negligible levels. And that's what I've got. And here's our information. Agnes gave me our booth number, where some of our folks will be, is in booth 2U as in uniform 03. So we're looking forward to that show.
Thank you so much. Thank you all our speakers. So to our attendees, if you have any questions, please feel free to submit them via the Q&A button at the bottom of the screen. As I've mentioned earlier, this session is being recorded and will be placed for on-demand viewing on our digital edition integrated virtual system, which will begin from 1st of August. So let's just give the audience a bit of time to submit their questions. Okay, looks like our speakers have all done a very great job, with very detailed explanation of their products. So in that case, if anyone has any other questions after this that you think of later, feel free to send us an email, and we'll be happy to pass it on to the speakers as well. So once again, I'd like to thank all our speakers for joining us today, especially from where they are based. It's really late where they are now. So thank you for your time today, and for all our attendees as well. You can still meet our exhibitors at the show floor, as they have mentioned, the various booth numbers at Medical Fair Asia and Medical Manufacturing Asia, which will take place physically from 31st August to 2nd September at Marina Bay Sands, Singapore. If you have not registered your visit, please do so today. And this will also allow you to attend more of our webinars in the upcoming weeks leading to the physical event itself. We have webinars running every week. On some days, we have 2, even one in the morning, one in the afternoon. The next one will be next Wednesday at 13th July. So with that, thank you very much once again, and we look forward to seeing you soon.